Some diseases rarely make global headlines, even while affecting millions of people every day. Schistosomiasis is one of them, a neglected tropical disease caused by parasitic worms that continues to harm communities, primarily in Africa. It is most common in poor and rural settings, especially where people rely on fresh water for farming, fishing, or daily life, and where access to safe water or sanitation is limited. The parasite lives in fresh water and infects people when they come in contact with contaminated water, like when they are working or playing. Children are especially vulnerable. Many are infected before the age of 10 with long-lasting symptoms like anemia, delays in development, and organ damage. Recognizing the scale of the problem, the World Health Organization has set a global goal to eliminate schistosomiasis as a public health problem by 2030. The VASA project is working to support this target set by the WHO. The Vaccines Against Schistosomiasis for Africa project is a global health collaboration with 10 research institutes around the world working to advance the development of a safe, effective, and affordable schistosomiasis vaccine.
Schistosomiasis is endemic in 78 countries. 200 million people are currently infected. 800 million more are at risk of getting the infection. So if we are able to develop a vaccine against this disease, we are talking about an impact for about 1 billion people.
Schistosomiasis in communities like Burkina Faso has both a medical and a social face. I'm talking of a country where people live in high-risk environment. Many rural communities in Burkina Faso depend on rivers, lakes, and irrigation for farming, fishing, and bathing. These practices are well known as potential risk factors of getting infected by schistosomiasis. The health impacts of the disease are well known by scientists, but not by the population.
I try always every year to treat people freely because I know what is the consequence of schisto in the productivity, in the school, in the agriculture. Last year we have those clinical trial for vaccine against schisto at the University of Tenerife at EMIVR. VASA project is a project for bringing vaccine in Africa to fight schistosomiasis because schistosomiasis is one of the causes of the poverty for the population in Africa.
The VASA project consists of several interconnected work packages which look into estimating the disease burden of schistosomiasis in Burkina Faso and Madagascar, the conduct of a clinical trial, it's a phase 1b study looking into the safety of the schistosomiasis vaccine, and also looking into health economic components like how much disease costs and what could be the use case for a vaccine when it's introduced in endemic settings. A further component of the project is the development of a challenge model, which was developed by our partners in Leiden, which looks into the immune response of the people when they're infected with schistosomiasis, and it's a helpful tool when evaluating vaccines in the future.
As the second clinical trial to our CTU, the first being a phase 2 COVID-19 vaccine trial sponsored by IVI. The VASA project supported the training and qualification of staff that support different aspects of the trial, from participant consent and enrollment to safety monitoring and reporting during the clinical trial period, adhering to good clinical practice and ethical standards. The project also contributed to the strengthening of labs to meet international standards to support clinical trials.
Partnership is very important in research on schistosomiasis. The problem is complex. It requires cooperation across disciplines, across sectors, and even across countries. Research on such a disease requires multidisciplinary expertise, resource sharing, capacity building. All this cannot be done alone. We need to partner for a matter of efficiency. The partnership also allows us to share results and experience. This is what enables us to be effective in our research.
I think this VASA project was one of the opportunities for us to have this large international collaboration to connect material, which has been a good opportunity to just share our experience and also learn from them.
I hope that in 2 or 3 years, Africa could be free for schistosomiasis.
Schistosomiasis has held our communities back for generations.
But now, with VASA, we are changing the story.
From the lab to the clinic.
From data to hope.
VASA is more than research.
It's a pathway to protection.
For everyone, everywhere.